and you're now in an excitatory state in your nervous system, as in withdrawal symptoms. Blood pressure is high, pulse is high, sweats, shakes, and if it's bad, people's brains get overly excited, they have seizures, okay? So that's why we treat withdrawal symptoms, okay? And then, of course, we treat we detox you, and then over time, of course, your body starts to replete those neurochemicals slowly, and slowly brings it into balance. But for a long time, it takes time for your brain to really recover, and that's supposed to be withdrawal.
Would the tolerance then be similar to what we often call a functional alcoholic?
Yeah, you could say the alcoholic's functional. Exactly right. That'd be a good term. They're showing up at work, they're doing well, they're drinking pretty heavily, but their body's sort of adjusted, and they'd say, "Oh, I'm doing just fine." What are you talking about?
Yeah, they don't have any consequences going on. Possibly.
That's correct. So that's that. So basically, I want to talk quickly about treatment. I like to break treatment down into different phases. Okay? Treatment, first is the behavioral intervention phase. That's just where we put someone in the hospital, take their drugs and alcohol away from them. And then we go ahead and detox them. And it's very important to have a good evaluation during the initial phase of treatment. The behavioral intervention phase, people show up at the hospital all the time and their brain's toxic, okay, from drugs and alcohol use and a combination of withdrawal. And usually they're angry. Who are they angry at? The wife that put them there, the doctor that's keeping them there, the night staff, someone. And why are they mad? Why are they angry? Well, it's like taking out water away from someone who's thirsty. It's like taking food away from somebody who's hungry. That drive is there. It's been there for a long time. So we detox them, and then we have to give them an evaluation. I've talked mostly about addiction being a brain disease, neurochemistry in the brain, but alcohol and drugs affect every organ of the body. And we need to evaluate people's medically, check out their blood, their liver, their kidney, their lungs, their heart, because alcohol and drugs affect all parts of the body. We also have to evaluate psychiatric comorbidities we talked about. People come in, they're there for alcohol, turns out they have bipolar disorder that wasn't diagnosed, they have depression maybe that wasn't diagnosed. It's not uncommon that we see people who come in with diagnoses like schizophrenia and bipolar disorder and depression, and they're not. It's alcohol and drugs. Most people don't go see their psychiatrist or their doctor and tell them how much drugs or alcohol they're using. So the doctor diagnoses them with depression and anxiety when he didn't even know they're drinking, 15 drinks every night. So part of it is evaluating and making sure medically and psychiatrically they're diagnosed properly. And then we have to come up with a treatment plan. Does this person need to be in the hospital, need to be in an outpatient program? What's the recommended treatment? Is the home life safe for them to go back to, or is the wife drinking too? You have to evaluate those things when people are in the hospital. And then there's the cognitive insight phase of recovery. That's where people finally understand that cognitive part of the brain, the cortex that says, yeah, okay, I have a problem, I have an addiction, I understand. The problem is that usually at this phase with cognitive understanding, the next thing they say is, oh, I'm fine now. Now that I know I have an addiction, I'm ready to go back to work and everything. I'm ready to just, and the truth of the matter is that we call that the 1-2. And we like to say the 1-2 doesn't work. Okay? And the reason the 1-2, if it did work, then what we do is detox you and give you a workbook and send you on home. Okay? And studies show that doesn't work. And if that worked, we wouldn't have treatment centers like Ridgeview and Peachford and nationwide if it was that simple to treat people with addictions. In order for people to really get well, they need to go through the emotional understanding phase to get to the transformational experience phase, or go through a spiritual experience. That last phase can take up to a year. The reason we try and get to that phase, usually when people have their spiritual experience or transformational experience get through their first year of recovery, people's recovery at that point is what we call locked in. It doesn't mean they can't relapse, surely they can, but the relapse rates are a lot lower. And so we try and get people to get all the way through to the fourth phase of treatment. What is the emotional understanding phase? Well, this is really what we try and do in outpatient treatment centers. Okay, we try and people come into treatment, let's say for example, someone shows up when they're 40 years of age, and you talk to them. They were abused when they were 6. Their parents divorced when they were 10. One of their parents or sibling died when they were 16. And they went through their own divorce when they're 30. They're having their own emotional problems with dealing with alcohol and drug problems. They show up at the hospital when they're 40. Well, they have a lot of issues. And I mentioned before how